Welcome. It is Friday. It is 12 p.m. Eastern Time. Welcome to Ask Dr. Geier Live, wherever you're watching. I hope you're making today your true masterpiece. My name is Dr. David Geier, triple board certified orthopedic surgeon, sports medicine specialist, and anti-aging and regenerative medicine expert. I help you feel, look, and perform your best regardless of age or injuries. Yes, it is that one time, that one place every week that I answer your questions, whether they're health and wellness, whether they're orthopedics or surgery or injury or rehab. This is the one place I do it. I don't answer questions, and really can't, by email. I can't do it by in comments left under my YouTube videos or anywhere else. This is that place. So if you have those questions, this is your chance to ask them. Always remember, just like anytime, today I am not giving you medical advice. Everything I say is meant for general information and for educational purposes only. I haven't seen you or examined you or looked at x-rays or MRIs or any of that because I'm not your doctor. And we can talk about how you could come and see me. I could be your doctor, you could be my patient, but I am not giving you medical advice in anything I say here. So please ask if any way you can. If you have any questions, ask them in a general sense. It is a rainy day here in Charleston, South Carolina, but that's okay. We normally have great weather. I think it's supposed to rain most of the weekend, unfortunately. Long weekend here in the United States, so I hope everybody is safe. And I want to just say real quickly, thank you to everybody who has served, who is serving in the United States military. We are very grateful for everything you do for this country. All right, let's go ahead and get started. Let's see. Mary, frequent commenter and viewer, very appreciate you always being here, Mary. What can we do when we start losing our balance? I'm not sure if you mean in terms of, and feel free to put this in, as you start to fall, lose, like in a specific instance, or to prevent losing your balance generally. There are a number of different stability and balance exercises that can be done, especially as you get older, for your hips, for your spine, for your core, for your hip hinges and things like that, that I think are really important to prevent it in a grand scheme of things. As far as in any one specific event, I don't know that I have an easy answer for you because it happens so fast and people react instinctually. I don't know exactly how you could influence that. Do you have any patients, Pennicin? Yeah, Pennicin does well. I've been very pleased with Pennicin, using it off-label, probably several hundred patients. Here's my thing about, well, let me read the rest of your questions. Yes, Pennicin polysulfate. And I appreciate you watching the video. Here's my thing about Pennicin. So do I think it's better than anti-inflammatories like ibuprofen or naproxen? Absolutely. I could do a whole video on why I have some issues with those type of medications or the longer form ones like Mobic, like Celebrex. I think the ibuprofen, real quickly, ibuprofen, naproxen, good short-term relief, just using very sparingly, certainly not a great long-term option. Pennicin works in a similar way, but also different way. It's stopping in a large, at least from what we can see from the studies, it seems to be very good at stopping the pro-inflammatory cytokines like interleukin-1 beta, interleukin-6, tumor necrosis factor alpha. And I know, Zora, you didn't ask about that, but in case people don't know what Pennicin polysulfate is and haven't watched the video like she has, it basically aims to stop the damage of the cartilage and bone in your knee or in your shoulder or in your cervical spine, your neck, your lumbar spine, your lower back. It seems to do that very well. Reportedly, the company Paradigm has some data that shows that it also helps to rebuild cartilage. I have not seen that in the published scientific research. So when that comes out, I'd be certainly happy to say this. Having said this, this is my experience, and I've talked about this in other videos. My experience now using it for well over 100 patients is it works well, but it doesn't do all that much by itself. Yes, it's better than nothing, and a lot of people get a fair amount better, but I like to use it in combination with things that work in other ways, help to rebuild cartilage and bone, help to strengthen, support, and strength and support the tendons, ligaments, and muscles around the knee or around the hip or around the spine. And I feel that really gets the best overall outcome, the quickest outcome, the best pain relief, the best restoration of function. But is it better than a lot of what's out there? Yes, and it's why I do expect that it will get FDA approved here in the United States in the next year or two. It's in phase 3 trials right now. It actually got fast-tracked for phase 3 trials by the FDA last April, I think. So I do expect it. It'll be interesting to see how it's administered once it's FDA approved. I expect it'll be similar to semaglutide, the peptide that is now sold as a medication, Wegovy or Ozempic, where they have some kind of auto-injector, which presumably I assume they don't assume or don't think the majority of the population can actually give themselves injections. And that's one of the reasons I've heard for why it's so freaking expensive, $1,000+ a month, when the medication actually isn't anywhere close. I mean, it's just a small fraction of that amount. And so I wonder if penicillin is going to be the same thing. I think that would be unfortunate, but it wouldn't surprise me. Anyway, do I like it? Yes. Do I like it by itself? Not nearly as much as in combination with other things. Let's see. Mary, I don't feel stable when I walk since I have a limp from a fractured femur 3 years ago. Again, not medical advice, but that's a very, very common complaint, whether it's a femur fracture or really lots of different injuries, especially the lower extremities, but spine, pelvis, you see that a fair amount. I have patients, and to be fair, I don't get as many people during the initial trauma anymore. I'm not in a hospital-based practice anymore, so I'm not dealing with hip fractures or motor vehicle accidents or things like that. But I do get people that have had a lot of those injuries and are trying to improve their function and decrease their pain and get back to different things they want to do. And in that case, I do feel there's a very important role to work with a physical therapist to strengthen those and work on the stability of your lower body and of your spine and of your pelvis. That is probably the easiest way. Yes, if you go online or go on places like YouTube, you can see videos for some of these exercises. The problem with stability exercises, in my opinion, other people may feel differently, is that if you don't do them with the right form, the absolute perfect correct form, they may not accomplish much, and you may put a lot of time and not get that much better. Stability exercise is also very important really for everybody in terms of preventing injuries with activities like running and jumping and lifting weights and things like that. So I'm a big fan. That's how I would do it if I was overcoming an ankle injury, a foot injury, a knee injury, and I was trying to get back to what I wanted to do, is I would work on stabilization exercises with a physical therapist or somebody that is skilled in that. I know that there are some personal trainers and strength and conditioning trainers that have specialized training in stability. They may be good as well. These are typically not the trainers at your local health club, but you can find them. Physical therapists, especially that specialize in sports medicine, typically very good at that. Let's see. Hip osteoarthritis, yes. I've used it a fair amount for hip osteoarthritis. They do tend to improve their range of motion, but it depends on what the nature of that arthritis is. If it's bone on bone and that lack of space in the joint is what's limiting motion, maybe not as helpful for that. But if it's pain-related loss of motion, I feel it can be fairly helpful. Georgia, it is good to see you again. I am very happy that see a couple regulars here. I will make this a fairly short show today, actually. Friday, we're going to be done in less than 10 minutes. And that's okay, because it's a long weekend here in the United States. Again, I wish everyone the best for this Memorial Day. Please stay safe. If you'd like to see me as a patient, I've got people from all over the country who come to see me. I've got people from other countries who come and see me. You know, I don't use this show specifically to try to talk you into being a patient, but I do feel like I offer a lot of things that are different than just surgery, cortisone shots, and physical therapy. So you can find more information about that in the description below. Click that link. It goes to my website. There's a contact form. Fill that out, and my assistant and I will get back to you about how to set that up. And Zora, you are so welcome. I am grateful that you found it helpful. I really do enjoy answering questions and trying to help. It's hard with my full practice schedule and trying to create content to really answer specific questions. At one point I was getting probably 400 to 1,000 questions a week, and I finally decided, look, I can't even do this in general form. It's just too much time. So this is really the one time and place I do it. So I'm very, very appreciative of that. So, and Elizabeth, I did not see your questions about penicillin. Hopefully in my answer that I gave Zora that you got that. I don't know. Maybe you left those in the comments and not the chat, but I can't see the comments because I'm not on YouTube. I'm on a service called Restream that sends it out to Facebook, that sends it out to Twitter. So how soon to expect improvement? Everybody's a little bit different. I'd say somewhere 2 to 6 weeks it starts getting a little bit better. Sometimes it's a little longer than that, but something like that. Everybody's a little different. You have to remember, arthritis is not the same in every person. It can be very significant joint damage. It could be very early. There could be a variety of other issues going on. So, but that's typically a general range of pain relief. Very, very appreciative. I think I've gotten everybody's on here. Actually, there is one more. Patella tendon 8 days ago. BPC, vitamin C, collagen. What else? You know, again, I can't give you advice. I think all that's reasonable. The big thing I would say is after patella tendon surgery is it's a lot of work getting range of motion and strength back. So the rehab has to be very good. Get somebody that does that a lot and is very good at getting people back, because the mistake I think that some surgeons make and a lot of therapists make is they go too slow on the early phases of rehab and they never get full range of motion back. And if you don't get full range of motion of the knee back, it is an absolute disaster in terms of trying to do normal activities. And there aren't a lot of great options to get that knee's motion the way the other side's is. So then you work to get full motion back, and then you work aggressively, really aggressively, to get strength back. That surgery is pretty straightforward, but that rehab is long. It is very long. As far as other things, the things you mentioned all sound reasonable. I don't know that there's anything necessarily I would add to that. Yes, there's some peptides that can be helpful in addition to CJC, but since peptides are experimental, I won't get into too much of that, but know that there are some things out there that I use with my patients sometimes, and that I know work with other physicians that do regenerative medicine treatments. Thank you guys so much for watching. I hope you have a wonderful weekend, or if you're in the United States, a wonderful long weekend, and I look forward to seeing you really soon on the next Ask Dr. Geier Live. Have a wonderful weekend. Take care.